Hello, welcome back. Welcome back to Minister Fit. My mission is to educate and spread awareness about many things through this channel. The information contained in this video is of general nature and does not constitute medical advice. Talk to your doctor for your individual circumstances. Don't forget to hit the like button and subscribe to my channel at the end of the video. Thanks. This week we'll be talking about 2019 novel coronavirus. As of the end of January, this 2019 novel coronavirus outbreak has been declared a public health emergency. The president has suspended entry into the country for immigrants and non-immigrants, people which are at risk of spreading the coronavirus, and also people who have been to China within the past 14 days. They are recommending that travelers avoid all non-essential travel. They are saying that layover flights in China also count as having been there, and those people may be subjected to health screenings on arrival, along with self-monitoring or quarantine. U.S. citizens and their immediate family who have been to China will be allowed to enter the U.S., but they will be subjected to health monitoring and possible quarantine for 14 days. The Center of Disease Control, which I will refer to later as the CDC, has sent teams to different states to assist the health departments with clinical management, contact tracing, and communications. The CDC is shipping test kits to certain labs that have been deemed qualified to use the kit, local health laboratories and departments of defense. However, it will not be going to healthcare facilities. The state and local health departments will contact the CDC Emergency Operations Center to report the person that needs treatment, and the EOC will determine whether testing is required. The Emergency Operations Center will help the department to collect, store, and ship specimens correctly. Public health officials are working hard to find the source. They are analyzing the genetics of the virus so they can find the specific source of the virus. Still little is known about the new virus. They believe coronavirus is genetically related to SARS, which means severe acute respiratory syndrome, that had an outbreak years ago, more than to MERS, which is Middle East Respiratory Syndrome, because they both are beta coronaviruses, which their origin is in bats. They are unsure if the virus will behave in the same or similar manner as before as the SARS and MERS did. The researchers are going to try to use data and information that they have from previous research on SARS and MERS to help guide them. If you have been in contact with anyone who has traveled to China, or if you feel ill with a cough, fever, or shortness of breath, you should stay home and restrict your outside activities. No work, school, public areas like the train, subway, taxis, or ride sharing. No shopping centers, gyms, salons, movies, or stadiums. You guys get the point, right? That means basically you go nowhere at all. You should not be around anyone in your home. You have to stay in a specific room and also use a separate bathroom. Get medical attention as soon as possible, but you should call the facility before you go so the staff can take measures to keep everyone safe and decrease the risk of more exposure. If you are having symptoms, you should wear a face mask when you are around other people. If you can't wear a face mask due to difficulty breathing, then the other people who are around you should put on a mask. You are not allowed to share anything in the household with anyone else. No dishes, glasses, cups, utensils, towels, clothes, or bedding, etc. Wash your hands good with soap and water for at least 20 seconds, especially after going to the bathroom, after blowing your nose, coughing, or sneezing. If you feel like your symptoms are getting worse and not better, then you need to revisit the medical site and let them know that you have been or are being treated for 2019 novel coronavirus, and make sure you wear a mask, face mask, and follow the same safety measures as the first visit. Once you revisit the clinic, the healthcare provider will call the local or state health department to receive further instructions on how to treat you. The 2019 novel coronavirus is a new respiratory virus that emerged in Wuhan, China. This is a new coronavirus that has never been identified before. Coronaviruses are a large family of viruses that are common in many different animals like camels, cattle, cats, and bats. Rarely have animal coronavirus ever infected people and then was spread between people. 2019 novel coronavirus is a beta coronavirus like MERS and SARS, both which have their origins in bats. SARS infected people and the virus came from civet cats, and MERS infected people and the virus came from camels. When novel coronavirus emerged, a lot of people with the respiratory illness were said to have been in a large seafood and live market, suggesting animal to person spread. then a large number of patients that didn't have any exposure to animal markers, which indicated person-to-person spread. Respiratory viruses are most contagious when the person is the sickest. Novel coronavirus can be spread person to person simply by being in close contact with each other, about 6 feet. Respiratory droplets produced when the sick person coughs or sneezes. The droplets can land in the mouths or noses of people nearby, or it could possibly be inhaled into the lungs. Currently, there is no proof that you can catch 2019 novel coronavirus by touching a surface or object that has been in contact with the virus. But since we are not sure, just don't put your hands in your eyes, nose, or mouth after touching objects and surfaces. The virus may have initially been started from animal to person source, but now it's spreading from person to person, and the number of illnesses, hospitalizations, and death continue to rise. Symptoms: mild to severe respiratory illness, cough, and difficulty breathing. Treatments: there's currently no vaccination shot to help prevent 2019 novel coronavirus infection. There is no specific antiviral treatment. Treatment would consist of supportive care to help relieve your symptoms. For severe cases, treatment will include support for vital organ function. Prevention: do not leave the house and do not travel while feeling sick. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Be sure to cover your cough or sneeze with a tissue or in your sleeve. Try to avoid coughing and sneezing in your hand, and be sure to dispose of your tissues in the trash. Clean and disinfect things that are touched by people frequently, like doorknobs, keyboards, remote controls, workspace, desks, and countertops. You can use wipes or a disinfecting cleaning spray. Wash your hands with soap and water for 20 seconds or more. If you can't wash, you can use a hand sanitizer that has 60% alcohol base in it. People at risk. Well, everyone is at risk if you come in contact with an infected person. But how will you know if a person is sick or not? We literally will be going around afraid of every person that coughs or sneezes. Keep the recommended preventions embedded in your mind. The risk of this outbreak depends on characteristics of the virus, like how fast it's spreading, how severe the cases are, what medical and other aids is available to control the impact of the virus. The people at an increased risk are healthcare workers, who at some point will probably come in contact with the virus. Nurses, CNAs, physical therapists, occupational therapists, dietary, home care workers, and caregivers. Please be extra careful. Healthcare workers, be aware and look out for your patients who recently traveled to China and who are symptomatic. Healthcare workers also know what's going on with your patients, because the facility does not always tell us what we're working with when someone's a threat. Animals. There's no evidence to suggest that animals or animal product imported from China pose a risk of spreading the virus. Do not handle pets or animals while sick. Several types of coronaviruses can cause illness in animals and spread between animals and people. The CDC, the U.S. Department of Agriculture, the U.S. Fish and Wildlife Services play distinct roles in regulating importation of live animals and animal products into the United States. Centers of Disease and Prevention recommendations. Everyone should try and do their part to respond to the public health threat. It's flu and respiratory disease season, so if you haven't had the flu shot, they suggest doing so. Take preventative measures to help to stop the spread of the germs. There is still much to learn about the transmission, severity, and other features associated with 2019 novel coronavirus. The investigations are ongoing. This has been your host, Imani. Don't forget to hit the like and subscribe button at the end of the video. Be safe, be aware, keep your hands and surrounding surfaces clean. Thank you.